in there, okay? So it's just in here. Okay.
Lots of patients who come in with upper neck issues will experience things like vertigo, dizziness, problems sleeping, anxiety, depression. We're seeing things like even PTSD. So the way the nervous system is taking on information from past trauma that we're trying to create healing. Hey, I'm Dr. Matthew Posa, and I'm a corrective care chiropractor in Milton, Ontario, Canada. Today, I'm going to show you a Gonstead Chiropractic Adjustment.
All right, so start down here. So left short, come up. Turn your head to the left, look back. Look right, back in the middle. You go right in here. Right there, you're gonna roll. Right there, this one. Good. A little bit in there, okay? So it's just in here, okay? Nice one, okay.
Now, what's really interesting about the Gonstead Chiropractic Adjustment is that the spine is in neutral, meaning that we're not going to be putting any torques or any type of pressure through the spine. We have to do it in neutral in order to activate the entire joint and really to stimulate something called mechanoreceptors, which are in the spine, which will feed the brain to make a long-term change. I do want to explain that when the patient came in, we did a full history exam that included ortho, neuro, but more importantly, we also took x-rays. We analyzed the spine. We found a few areas. So these are the areas that we're adjusting today based on the testing. And also we did thermography. So we ran a thermographer up the spine. We were able to measure the spine, see where there's any differences in the spine, and those are correlated to what we found on the x-ray. So therefore that was a good case for the adjustment, and this is why we did the adjustment. After the adjustment, I will also show you what the scan looks like after, so you can see exactly how clear the spine became after. There's a huge difference between a Gonstead chiropractic adjustment, traditional regular type of chiropractic adjustments, and even some of the corrective techniques that I use. And really the name of the game here is to correct the spine, not just simply move it, not just simply make it feel a little bit better. We're actually trying to correct the spine to restore the proper alignment, curves, and the structure, so that way we're creating a long-term effect. And that is why we use these techniques and why we differ from many other clinics out there. And people watching, you're going to be looking for this type of technique, and it is going to be a little bit harder to find just because of the nature of the adjustment. It is a more difficult adjustment to do. If you do have any questions or comments, you could please leave it down below. I always do my best to answer those. Why would somebody even want a Gonstead adjustment? Well, really the difference here is, again, is the effect, the long-term effect. But also when we're adjusting this in this way, or we're adjusting the spine in this way, really what we're looking to do is correct any of the issues that might be causing a bunch of stuff. And in this case, it was headaches. Headaches was the primary concern, and even a headache bordering onto a migraine. So getting that relief, getting that long-term relief is extremely beneficial. Lots of patients who come in with upper neck issues will experience things like vertigo, dizziness, problems sleeping, anxiety, depression. We're seeing things like even PTSD. So the way the nervous system is taking on information from past trauma that we're trying to create healing. And that's the point of the adjustment. We're not only correcting the spine to make it feel better, but we're changing the neurology and the way the brain is communicating with the body. We're removing that pressure. We're taking the body from a sympathetic state, which is that fight or flight response, and we're bringing it more to a balanced response. So therefore your body becomes more adaptive, and that's where you feel the stress come off. In fact, one of the first things that people notice right after an adjustment is that their breathing changes. They feel a lot more calm. They feel a lot relief. And that is extremely common within this space. The other obvious reasons for getting an adjustment would be obviously neck pain or back pain or any type of tingling, numbness into the hands, into the feet. There's so many other reasons why people seek chiropractic care. But the Gonstead adjustment is what I was highlighting today, and I hope you enjoyed watching that.